definitely seen my numbers increase. For example, the month of June, I had 19 cases for the entire month. It actually had slowed down so much, I was only getting 2 and 3 cases in a week. And I'd keep checking, and I wouldn't have any cases. It was wonderful. It was wonderful. But now I'm getting 5 cases overnight, 8 cases over a weekend. I checked my numbers, and actually in 1 week, I had 27 cases in 1 week. We're up to 313. The difference is they're not all actively infectious. So when we were having our cases earlier, and they were coming in constantly, every single case was actively infectious. So we would interview them, they would isolate, we'd get their list of contacts, we would follow their contacts for 2 weeks. Now what we're seeing is what's known as probable cases versus confirmed. So when the confirmed cases we were getting, they were getting the nasal swabs. So that's a RNA, and it would literally tell you right now, am I infectious? So the blood work that we're hearing about, the rapid testing, when the state reports it, they report it as probable, but they're still positive. The difference is that they're antibody tests, so we're looking at if they've been exposed. There's 2 different kinds, what's called IgM and IgG. So IgM, I think of M for miserable. So that means that right now you are sick, you're infectious, even if you feel fine. And most people do. Most of the people we're interviewing say, I feel fine. But that's because they have a very mild case. And then the IgG is Ig gone. That means that they had it at some point. They are currently not infectious, but they have antibodies. So when we interview them, we ask, first of all, have they had symptoms in the last 2 weeks? Most of them say no. I either never had symptoms or, maybe I had a cold, 2 or 3 months ago. I wasn't sure. But they're getting tested now they might be going into the hospital to have a procedure done. They might be wanting to go on vacation, and they have to get testing done for that. And so they're coming up positive. So they are included in our positive case rates, but they're not quite as many. There's still enough to be concerning. Out of those 26 cases I mentioned, 11 of them are actively infectious. So that's still a decent amount. So we really want to get the word out that people need to realize that it's still a concern. Yes, most of these people, they say, I can't believe that I'm positive because I never felt bad. And it's great, We had the controls in place. A lot of people were staying home and wearing masks. But now we're seeing, we're getting out and about. And unfortunately, we're seeing a lot of not mask wearing. And that's a concern because this is how we're going to see numbers go up. I see enough people who are very good. Some people are very conscious of it. And the thing is, you're protecting other people. It's not just about you being protected. It's about protecting other people who might not have such an easy time of it. So, we want to make sure people still wear masks, still social distance, still wash their hands, because the hand washing is excellent if you touch something that might have the virus. So, a lot of information.
Now, how does this affect town hall reopening?
Well, we're planning on it. As you know, we're planning to open the doors on July 26th. So we have some precautions in place. We have new plexiglass barriers. The fire department were wonderful about creating them. So it just puts another barrier in place there. We would still love for people to make appointments when they can, to do as much as they can online or mail in, just to reduce the numbers in the town hall. We'll be wearing our masks. We'll expect people to be wearing their masks. And we have Purell and hand washing and wipes to clean up after people. So, things will be different. There's going to be markings on the floor. So if people come in to pay their taxes and need to come in for some reason, we'll see lines.
Wow, what a crazy time we live in now, right?
It is.
Now, also something that we had established, but now we got rid of because of the coronavirus, and you're gonna reestablish, is the ban on plastic bags.
Right, right. The plastic bag ban. So in North Attleboro in particular, that was established by bylaw last year. And then they gave a year for implementation for retailers to plan, to be able to order the correct bags and to be able to use up their stash. But what happened was, of course, with COVID, we couldn't use reusable bags because of the concern, and particularly for the clerks in retail stores, touching all these bags was not a good thing. So the governor had put a hold or a moratorium on plastic bag bans and said, no, you can't enforce them. People can't use reusable bags, which is what we want. We really don't want people to necessarily replace plastic bags with paper bags because that's not good for the environment either, but we want people to use reusable bags. So what happened was it was coming up, here it is June, and I'll be honest, it was something that wasn't high on my priority list at the time. But the governor did release that moratorium, did say that now you can use reusable bags, which means that now the plastic bag bin is in effect. We're doing soft enforcement because of the circumstances. Retailers really haven't had an opportunity to prepare for it. Some of them may have purchased extra plastic bags because knowing that they needed to give them out to the consumers, to the public. So we're getting the word out, sending letters out, and hope to get the word by this, actually, that people need to think about it. Use your reusable bags. You will see it enforced probably September 1st. So over this next month and a half, the retailers will begin the implementation. They'll make sure they'll use up the bags they have, get in the new bags, and hopefully we'll see more people using reusable bags.
Is there anything else that people should know about?
Well, I'd like to just bring up mosquitoes. Very good today happens to be a rainy day, which means puddles and things like that. But EEE is a concern for this year. People need to be mindful of it. Last summer, we had to deal with all these restrictions and communities being considered high risk and things like that. The way that the track goes, it's every 2 to 3 years you will have high numbers of EEE, and this would be a second year. So the Department of Public Health is saying, be careful, be aware. We actually just got our first positive mosquito in Plymouth County. It had been 2 up in like the air region. So people need to be mindful. We see more activity in August and September, which is as we go forward into the school and sports and things like that. But watch, make sure you don't have standing water, take your precautions, use your sprays, things with DEET, and just be careful.